We recently had an experience in our family that again reminded us of how much the HTC is our partner. It felt very personal because he was my own son. I always thought that I would never allow for coverage to lapse. And I was one of those people, and I know I have many friends in our community who feel invincible. We have good insurance, that'll never happen to me. And that'll never happen to me turns into it just happened to me.
It was really scary. I remember because I did the math and I figured out, well, $5 a factor. I don't quite have enough for 7 or 8 days.
I felt so very fortunate to have that relationship, not as a personal relationship, but as part of the community where we know that because the HTC exists, there is a safety net. There is an organization that cares for all in our community, whether we are patients of the HTC or not.
A Hemophilia Treatment Center is a center that specializes in treating patients and families who have bleeding and/or clotting disorders. The comprehensive care team at this particular center consists of multiple disciplines. So when a patient comes into their annual comprehensive care visit, the patient is able to see many professionals here.
So for example, we have a psychologist that helps address the mental health issues of our patients and their families. We have an educational specialist who helps our kids thrive in their schooling and helps our young adults apply for college and helps our adults who are having some learning issues possibly in their job.
Many of these resources have been made possible through the revenues that come in through a 340B pharmacy program. The 340B program was enacted by Congress in 1992. This allowed Hemophilia Treatment Centers as a covered entity to access discounted pricing for our patients. Many centers across the country have had these 340B programs or pharmacy for many years in their centers.
All the rules and regulations that are around the 340B programs, they're very tightly regulated programs. And one of the features of these programs is that all of the funds that are gained by the HTCs that have a 340B programs have to stay inside our hemophilia community.
We use our factor funds to support the salaries of our physicians, of our nurses, our social workers, and physical therapists. But not only that, we use our revenues to help support the more extended services that our patients and our families need. So we're using our 340B funds to train the future generations of care providers that are going to help the people in the bleeding and clotting disorders community. We have many other services that would not be available for our patients and their families without the support of our 340B program.
My name is Val Bias. I'm the CEO of the National Hemophilia Foundation. I have severe hemophilia factor IX deficiency. I've been treated at a Hemophilia Treatment Center since I was 5 or so. My first nurse was Penny Holmberg. She taught me to self-infuse around 11 or 12 years old. She let me practice on her arm. She was like my second mom. My next nurse, when I moved to San Francisco, was Susan Karp, and we were together for 29 years. I moved to Washington, D.C. I had a great nurse there at Georgetown. I live outside of New York now, so my treatment center is in Newark, New Jersey. So treatment centers have served me well throughout the years. They're the ones that are responsible for consistency of care. They have rehabbed me a number of times after I've destroyed myself. It's the reason that I can stand up and walk and talk.
I just recently climbed Mount Everest, which was just a crazy adventure. I did that just this last year. I think having the Hemophilia Treatment Center available to me made all of my goals and dreams possible, you know. So when I told them about my idea to climb the 7 summits, which are the highest mountain on each continent, they didn't freak out and tell me no. They're like, okay, that's a new goal, and we're just gonna have to modify your treatment and work with you on how to make that happen. And I've been going to the Colorado Hemophilia Treatment Center my whole life. I don't remember a time that the treatment center wasn't a part of my life. They're always there for you.
I'm a pharmacist from New Orleans, Louisiana, and I work with our Hemophilia Treatment Center. I'm part of the interdisciplinary team. My role is to optimize medication therapy in our patients. I do this in many ways. I spend a lot of time educating our patients. I help the patients manage bleeds. I help to increase their adherence by monitoring their logs with them. I get their factor to them in time. I manage assays so they're most cost effective for our patients and our payers.
The Hemophilia Alliance is an organization that helps support hemophilia treatment centers. It's made up of a membership of treatment centers with 340B pharmacy programs and has been in existence for almost 20 years. The mission of the Hemophilia Alliance is to provide support to hemophilia treatment centers who have 340B programs so that they can provide the services needed to their patient population. So the Hemophilia Alliance through the years has been able to bring Hemophilia Treatment Center 340B programs together as one voice to advocate for the needs of our patients.